recorder.
Got it.
So thank you so much, Dr. Vera, for agreeing to come to this special Zoom session that has been designed to help parents understand how sugar could negatively affect the children's life. So we have some questions to ask you, and please feel completely free to add all the information think that could be important for the parents. So my first point here, Dr. Vera, is because there's like a very big misunderstood about what addiction is. So considering that addiction is a brain disease, how can you say that sugar can affect the brain as the same other drugs do? Do you understand?
Yes.
How can you?
Yes. Okay. So yeah, that's a good question. So what's happening is that a drug is, just an external substance. Actually, it can even be a behavior, an excessive behavior. It's a substance that basically hijacks our pleasure or reward circuitry. And, we have a natural pleasure and reward circuitry that will motivate us to eat good food, to socialize with people, to go to work, to be interested in life, things that will sustain our life. And if you take those pleasurable activities and pleasurable foods, like, a whole grain or a whole food diet or something like that, or keto diet, doesn't matter, some kind of food that's not processed food, we enjoy that food. We don't overeat because it's just pleasurable. And then when you're full, you're full. Like, our body is really nicely tailored to handle the natural things in life so that we do the things we do to keep alive. But what happens with addiction is that someone, and it has to almost always be manipulated and maneuvered by somebody. It's not usually in nature by itself. It's somebody who wants to make a dollar, wants to make a profit on basically the illness of someone else. They have deliberately taken the ingredients that make normal life pleasurable and potentiated or enhanced them to a point that now we're driven to use that substance when we would otherwise say, no, I'm full, or no, I've had enough sex, or no, I've had enough of whatever it is that I'm doing, because it's time to move on and do something else. You can't do that anymore. I mean, the no inside of you is still saying, I'm full, that's enough. But there's when you've been hijacked by this reward circuitry, even though you're full, even though you're saying, I really should stop because I'm so full, I'm going to throw up, you're still going to eat too much. Now we're talking about food specifically, to the point where, although you're shouting a no, that drive to eat, in other words, the yes, is far greater. It's like, no is this and the yes is this. And you just simply can't, it's very difficult by yourself to address that yes. So that's really what addiction is when the normal circuitry and symbiosis and the perfectness of life, the synergy of life gets stretched out, so that instead of a yes and a no being equal, it's little no and a big yes. And that can happen with anything. So it can happen with behavior. For example, I'm looking forward to going to a movie, but I'm not going to see 10 movies today, because at the end of one, maybe 2 movies, I'm full. But what is it that's making me want to stay till the end of the movie and maybe even go to a second movie? It's essentially my curiosity and my drive to do things interesting. And that is dopamine, that neurochemical that makes me want to get up out of bed and do things. But if I have a behavior that enhances dopamine, for example, gambling, which is I really want to know what's going to happen next, because what happens next will mean that I'm going to win $1 million or lose $1 million. So and if that potential possibility is 10 times a day, I'm going to stay at that slot machine 10 times, like that whole day, until I can find out each time. So it doesn't even have to be a food or a substance. It can be a behavior, anything that stretches out the yes, basically. And so when we talk about sugar as or food as, how can that be addictive? Because we're all used to expecting that it's within that normal realm. It's normal to eat. Yes, it is. But the processed food industry has stretched out the yes. They've deliberately made the dopamine hijacked in such a way that even though I don't really want a third soda, I'm going to have it, or a third box of something else, I'm going to have it. And that can be sugar food, that can be behavior, it can be, I mean, we classically think of addiction as cocaine and alcohol and opiates, because we know there are dealers on the street, and we know there are people who are creating in the background crystal meth labs and fentanyl labs, and we know that people are doing that. Well, they're doing the very same thing in the food industry, but for some reason, you know, you and I and those of us in the field know that this is something that is equivalent to the crystal meth labs and the fentanyl labs. But until we have a shift in our view about sugar, because we think of sugar as love, see it instead as a potentiated toxin that is, I mean, yes, sugar is love if it's an apple, if it's a banana, if it's cherries, but not if it's, this thing. So that's how, it doesn't matter what the substance is. Anything that potentiates dopamine is potentially addictive, and sugar for sure. And we got to stop thinking of it as fun and love and exciting and something that we should give our little kids. Let me just finish this answer, because I'm going on, and I know you have other questions.
No, yeah.
Yeah, okay. I'm so glad that you're addressing children and that you're addressing parents, because that's where it starts. And that's actually, children are the most vulnerable of all, because they are entirely dependent on us to protect them. And this insanity of saying, well, if the child really wants it, we should listen to them. No, they're going to want a beer. They're going to want a cigarette. They're going to want the cigar that their dad is smoking. Would you give that to them? No. So it's up to us. It's up to us parents and us adults to protect our children. And so thank you for doing this talk, because I think it's crucial. Like, it's probably number one issue is we want to protect our children.
And do you know, Dr. Vera, I choose this topic because, first of all, because it's so hard to treat addiction.
Yeah,
possible, but it's not easy. And the other thing that really bothers me is the fact that parents love to give sugar to children.
Yeah,
they celebrate it. It's like,
I know they love the smile on the kid's face, but can parents please see that that's the little addict that's starting to be developed? And if you give the crack addict a crack pipe, you're going to get that same smile and that same happy dance and that same obedience, because you're giving the addict what they want. And notice when you don't, temper tantrum, the very same thing that happens with the adult who doesn't get their drug. And you're saying addiction is very hard to treat. Let's get the kids before they become addicts, because if you were to moderate just a little bit, not every day a little bit, but maybe once a month, once every 3 months, a little bit, like we used to do in my generation or generations before me, the child probably wouldn't become an addict and could actually sustain a tiny, tiny bit. But once you become an addict, that potential moderation is no longer possible. So let's get our kids before they become addicts, when it's not hard to change.
Yeah, Dr. Vera, another question is it true that, for example, if a mother consumes a kind of drugs, for example, like cocaine, when the children born, they gave birth to the children has this special enjoy these kind of things. Do you think this can change the children's taste in the mouth?
Yeah, it's they become predisposed. So absolutely. Yeah, so and one of the things we know about food specifically is that you can even just almost program your child to like the taste of food, so that somebody who's used to eating curry, for example, while pregnant, mom who's eating curry, baby will actually choose curry over something else like a bland potato, because they've already developed in some way a comfort. I don't know how that actually happens. It's the taste receptors, or I'm not sure what, but we've actually seen that there is a preference based on mom's preference. So now imagine if mom is eating a ton of sugar, baby is going to have a predisposition to wanting sweet things. Now, we're already born with a predisposition of wanting sweet and fat, because what is the first thing a baby has when they're born? Breast milk, which is essentially high in sugar and high in fat. It's the perfect combination. And for how long? Maybe for a year or a number of months. So baby is already predisposed to that, and then eventually has to be introduced by parents. So parents will say, but they don't like Brussels sprouts. So you wean them off the breast milk, and now it's like, okay, what do we give them? Well, they're not eating the Brussels sprouts. They will only eat the cereal that's high in sugar and maybe ton of ice creams with, so there's the fat as well. But parents have to actually introduce these foods in a gradual, it's almost like a weaning of regular foods. And I think I read somewhere it takes like 6 or 10 trials of just a little bit, like literally a piece, like 1 pea. You don't have to give them a plate of peas because they're just going to throw it away. 1 pea, and then they can eat whatever else. And then do that, then maybe 2 peas in a week or so. You don't have to do a lot, but keep reintroducing it, and baby will then, or now toddler is now going to start to develop a taste. So from basically from in utero while in the womb, we can almost program our children, and then we have to guide their taste in a sense. And when we just throw the cereals at them and think that baby has choice, doesn't have choice. It's up to us to help them choose.
And all the learning process is very slowly. Even to learn to eat things is a very slow.
Yes, probably 3 to 6 months.
Yes.
It's the same as when you're training a dog. I'm sorry to use this as a comparable example, but there's a window period when you train a dog how to be social. Like I think it's like 6 months to a year. You want to expose that dog to as many other dogs and people and children, so that when they're older, they're not shy and afraid of older people and screaming babies, because they've already learned those tools. And similarly, there's it's not a socialized, I don't know what the word is, but there's a window period where baby learns particular tastes. And it's all before, it's in that 6 months to 1 year to 2 years a frame of mind. So yes, it takes a long time, but if you do it steadily and persistently, you are actually programming that child to, in that window period when it doesn't take as long as when you're 40. Like I know a lot of people, they don't want to eat vegetables, they hate them. Eventually they come to like them, but it takes a long time. It takes much less time with the child. So just see it as you're setting this kid up for success rather than disaster.
But do you think that when children is used to eat like sweet things, it's harder for them to eat those and real food?
Absolutely. Yes, it is. It's definitely hard. That's why I'm saying get them before they get to that level. And and it doesn't mean that if they've had sugar ever, they're gone. They may not have developed those tendencies firmly enough, but the sooner you can do it, and the more persistently, and the younger, the better. But still do it. I mean, even the 50-year-old will be able to eventually lose their taste for sugar, but they could take 6 months or a year as opposed to a month or 2. So, but definitely it's harder. And, we have kids now with, that's all they're eating. So it's going to be a big task, and it would actually be doable, except that society doesn't support us. They just say, don't be silly. A child needs to have this stuff to feel normal. And if we had a view of these foods as actually poison or as difficult, we would have mommy groups that, instead of supporting you in breastfeeding, like I think it's called the L'Arche Society, we should have mommy groups that are trying to help kids wean off of these processed foods and onto good foods. That will be in the future, thanks to podcasts like this.
Yeah, and we have to spread this idea, because there are so many critics. I have met some mothers that they try to learn to teach children how to eat well, and are so criticized by even for their families.
I know, of course, because families want to give it to them, especially the grandmothers. They're used to having the kid run. Yeah.
Grandmothers are a big problem for all mamas who try to.
But you know what? This is where Facebook, I mean, I'm in the generation that uses Facebook, but this is get support is really what I'm trying to say. Get support. So, and tips and cues and tricks and things that you can do in these difficult situations. Because we don't want to acknowledge, yes, it's going to be hard, because you're living with a child that's already converted to eating refined carbs, and a society that won't support you, but it is doable.
Yeah, this is true. I would like to address a point that I never have talked before in my Instagram. That is sugar as a gateway drug.
Yes. Okay. So absolutely. And thank you. I mean, that's that's why I get all up in arms about this, because I'm an addictions physician, and I see that the younger a person is exposed to a drug, the more likely they will get entrenched and then become addicted, and they may not remain addicted to that initial substance, but something. And so a classic example is cigarettes. Kids start at 7 or 8 years old sometimes, or 12 years old. The ability to quit smoking becomes harder because it's essentially, I mean, the human brain develops. We used to think, from, I guess, zero, from birth, actually even before birth, all the way up to probably 17 or 18. But now we're recognizing, no, it's probably like 26 years old. But there's a fundamental period of development that happens, especially in the teen years. And when people are smoking cigarettes, marijuana, oh my God, I just pull my hair out when I think of I'm in Canada and we've legalized marijuana. And as a result, people are thinking, yeah, it's no problem, it's okay. No, it's not okay. We're thwarting the brain development so that IQ can be dropped by 10 points thanks to a regular marijuana use. Now, I don't know what the equivalency with this sugar, because I don't know if it's actually been studied. It might be, and I'm just not aware of the research. But when we're actually thinking that these are just different venues towards affecting the dopamine in the brain, doesn't really matter. Then it's still going to have the same effect. So there's a brain, you're thwarting potential brain development, if not actually neuronal health. Definitely how to manage mood, how to impulse control, how to socialize well. These are all tools that, especially in teenage years, you learn. And if you're busy stuffing your face, smoking a joint, you're not learning them because you're busy, engaging in the addictive behavior and not learning the appropriate tools. So there's actual fundamental development that's not happening when you're using a drug. And food, I'm not talking about occasional chips, but that's not the addict. The addict is, and I bet you know this, the kid who is so mad they're going to have a temper tantrum because they can't have that candy right now, and embarrass the parent, so the parent just gives it to them. That's addictive behavior, and there's a sign that there's a problem there. It's not their fault. It's our fault, actually. It's because we haven't, protected our child. But anyway, so the brain development stops. But then even worse than that, when a brain, even an adult brain, is persistently, continuously, regularly, frequently exposed to a substance that is overwhelming the dopamine circuitry, the brain will start to adjust to that overwhelming process, and it actually starts to change in a way to protect itself. And that change is actually the beginning of this phenomena that we call addiction, because there is a biological change that happens. And as that happens, and the change happens, one of the things that happens is it doesn't matter what drug it is, but the person becomes even more likely. If you're a smoker, you're more likely to feel the effect of alcohol. If you're eating sugar, you're more likely to, it's almost like you become more sensitive to another drug, so that it becomes what we call a gateway, one which seems benign and safe. It's not as bad as something else. But it does open the door for the potential for another drug. So when I see a kid shoving their face, in the movie theater or at the exhibition on the rides with a ton of stuff, I'm thinking this is potentially somebody who is exposing themselves, predisposing, that's the better word, predisposing themselves to becoming a cocaine addict later. Or a something addict. I mean, there's no end of potential addictions that are available to the adult. It could be sex addiction, it could be spending, shopping, could be work, but we're all becoming potentially predisposed by these gateways, because you've opened up one way to really let that dopamine, the hijack process happen. And now the dopamine is already hijacked, and it only takes a little bit of something else to flare it up.
Yes, I think this is very important, Dr. Vera, because most of us, when you're not working and when we don't know nothing about addiction, you used to think that addiction is a psychological problem. So you can this link between there's a substance that is hijacking your brain and start to work in that way, whereas dopamine is so stretched.
Yes.
And that's
it's actually both. There's the biological, and then there's the psychological too. So, I mean, it's a double whammy in that respect, but it isn't just psychological. It actually, I think, starts with biological, because there are some people, and somebody listening might be thinking, yeah, you know, I don't know what she's talking about. Some people are not as sensitive to sugar and carbohydrates. It could be a genetic thing. It could be, you know, their DNA, like it could be an ethnic thing, because it does appear that some cultures are more predisposed than others. So not everybody is, but the majority, it appears, are. Because of, maybe they wouldn't have been if there wasn't so much exposure, but the sugar industry, the food industry has gotten its feet in every possible way, like, so that even if you weren't really predisposed, you've been hit over the head by sugar. How can you not? Like in my day as a child, it was considered rude to be eating while you're, you know, at a doctor's office or, you know, somewhere. Now it's like, it's just second thought. People will sit in front of my chair and pull out their thing while we're talking. It's just considered normal. So the prevalence is so much higher now because the food industry has normalized stuff that was not normal even 20, 30 years ago, and certainly not normal 200 years ago.
Yeah, and today it's have been normalized as well, the fact that you eat many times a day.
Yes.
Not 3 times a day. You are all
exactly. Yes.
Yeah.
And yes, and we become afraid of being hungry. Yes.
Yes, this is very important. Dr. Vera, I would like to address a topic. I don't know if you have time enough, but
Yeah, we're good.
Food addiction has so complete behaviors than anorexia. There's a link between, because anorexia is a very huge problem for most of teenagers, especially. Yes. So can you address a little about this? I know that you don't have any time.
No, it's an interesting thing. So, you know, the overlap of food addiction and eating disorder is there's a huge overlap, and it's actually part of the problem for doctors to acknowledge that food addiction is actually something different than eating disorders, because they look so much the same that doctors will say, well, why do we need to throw in another term? Let's just call it eating disorder. But it's actually a fundamentally different thing, but they look the same, and often there is an overlap. I actually think that, well, I don't know, I personally, but I am biased, think that a lot of what is defined as an eating disorder, like anorexia, even anorexia, and certainly bulimia and binge eating disorder, are actually food addiction in disguise. Because now I'm not saying that the other doesn't exist, that you can't actually be anorexic pure and simple. You can, but I actually think that there's a bigger number of food addiction in disguise than just pure anorexic or eating disorder solo. So remember, I was talking about gambling. It's behavior and it's substance. And you can, you know, when gambling, I'm just anticipating a win or a loss. And what happens with eating disorder is you're anticipating food or well, no food or weight loss. Like you have two goals. It's either weight loss or it's food. And again, nothing has to go into your mouth. It can just be an anticipation. And in other words, a behavior or a thought. And with anorexia, you know, it's not just a little, I want to lose 10 pounds, you know, because I want to fit into my old wedding dress or something like that. It's like, I want to lose, like, instead of being 110 pounds, which is already too thin, I want to be 90 pounds, 70. Oh my God, 70 pounds. I can't believe it. It's great. And, you know, it's in such a strong need to have weight loss that, you know, we know there's body dysmorphia. The person's view of how they look has become distorted, which, by the way, is a common phenomenon in addiction. It's called denial. It's called the delusion that fits with addiction. So, you know, if I'm an alcoholic, my delusion might be, I can manage my drink. I'm going to have only 2 and I'm going to stop. Well, the anorexic is, if I lose another 10 pounds, I'll be fine. But we all know that when they lose that 10 pounds, they're going to want to lose another 10 pounds. It becomes an addictive pattern, just the anticipation of it. And then, you know, when it's potentially addictive, because if you make them eat, and they don't want to eat, if you make them eat, like, you know, basically put an IV in them and force feed them, they will, it's almost like their high becomes deflated and they get very upset with you, in the same way as if you don't give the drug addict their drug, they get very upset with you. So you're robbing them of a potential high, which is that anticipation of losing maybe even 40 more pounds. Maybe I'll be 50 pounds and then I'll be perfect. Of course, that's crazy. You probably will be dead, but the person won't know that. So when a person is trying to lose weight, anyway, so that becomes an addictive pattern. That's really what I'm trying to say there. And then the other thing is that anorexic, even though they're not eating food, they are thinking about food 24/7. They're not eating it, but they're thinking about it. So they might say, okay, I'm only going to have 4 nuts today. That's it. Or 4 nuts and half of a thing of cheese, an ounce of cheese. So you give them their ounce of cheese and their 4 nuts, and they're going to cut it up into special, and they're going to make all sorts of patterns. Like that's all they're thinking about is that 4 ounces of cheese or whatever it is. Point is that there's still an obsessiveness around. So it's an addictiveness around it. And how do we treat that? I think this is one of the reasons why eating disorders is so traditionally not that successful. Like there's what we call a high recidivism rate. They get well, they go out of the hospital because they've gained weight, and then they're back in the hospital in 6 months or a year. And my guess is it's because they've been allowed somehow to let that addictive, if you don't address the addictive drive, then it's just going to pull you back in again. And so what do we do with a food addict versus an eating disorder behavior? We will actually acknowledge there's a behavior. So we will force the person, not forcing them through IV, but force them to basically weigh and portion control their food. They have to eat a certain amount, but not too much, because the bulimic will eat too much and thinking, well, I'll just throw it up in anyway. And then the anorexic, well, I'm going to try to make it even less. No, you got to have this much, not less, not more. It takes the person out of that realm. But that's an extreme measure, an extreme treatment. And it would only be necessary for somebody who has an extreme disease. And we know anorexia, bulimia, actually there's a high death rate with these. They're much more serious than people give credit to. And so is food addiction, much more serious. The only thing is with food addiction, we don't call the deaths of food addiction related deaths like we would, an opioid related death or an alcohol related death. We call it diabetes, we call it high blood pressure, we call it stroke, we call it heart attack. We should say heart attack secondary to food addiction. And if we did that, I bet you we would have a much higher acknowledgement of what food addiction is, and then potentially what we're doing to our children.
Yeah. Although food addiction is the most prevalent addiction nowadays, no one takes it seriously, no?
Yes, yeah, that's right.
Yeah, I don't know why this happens, but this is true.
Yeah.
No.
Yeah. I mean, I think it's true because the food industry has no incentive. And unfortunately, the medical community, I don't want to impute motive. I mean, you could say, well, they're making money on their medications and their surgery, because that's essentially what they offer. But if I don't impute motive, it might just be that we tend to, in the medical world, we're dominated by peer-reviewed studies and sort of particular ways of thinking. And if other people aren't thinking this way, they're not being challenged. There's very little research. It's actually starting now. We're getting more and more as the food addiction crowd, like myself and you and others, are speaking out more. There's actually more research, but not enough yet. Not enough for this generation. And so they don't want to. Why would we want the research first? Well, do I as a clinician have time for that research, which could take the peer-reviewed research is a lot of money, and it takes 4, 5, 6 years to get I don't have that time when I have a patient in front of me right now who's going to die of their diabetes or whatever within the next 2 years. So we have to sort of act without it. But the general medical model, they don't want to do that because it's against their grain of which is a very conservative grain.
Yeah, so congratulations for your courage, Dr. Vera, because you're the inspirational voice in this field. Just to finish our interview, please,
okay.
To give like a great advice for parents. Why do you like that parents knows more than everything?
For parents?
For parents, yes.
Yeah, I would say that as best you can, here's the thing. When parents used to ask me about, I don't want my child to become a drug addict. I don't want them to become a marijuana addict. The advice that we would often give is, it's going to sound crazy, but if you can, move from the environment where the externals are all to encourage them to smoke pot and smoke cigarettes and whatever. And if you can't move, then get them involved in behaviors like sports or yoga or something where there's a mindset that the body is a temple and you don't want to destroy it, so that you're not telling that the child is not thinking, I can't have this bad food because it's so good and mom says I can't have it, but instead I don't want it because I want my body to be healthy and whole, and I want to be an athlete and win over other people, and I need a good body. So you have to find a plus, a pro. So in the food world, as much as you can with your children, recognize, especially if they're already addicted, that it's going to take a long time, but persistence and love and whatever you can to make them feel like this is a good thing I'm doing, like get them to cook their own meals that are good, healthy meals, and then applaud them. Good for you, you made this wonderful thing. Gradually, slowly introduce foods they don't want, knowing that like vegetables and fruits, knowing that over time their tastes will change. So basically, have patience, change the environment so that it's a positive change that they want to make. And as much as you can, get support so that you're in the like-mindedness with other parents, because otherwise you're going to be derailed at the next party when they say, aren't you being a little too extreme with this? And parents, like you said, family themselves are going to be saying, come on, let them have this. Get as much as support as you can so that you can basically take care of your kid the way that we should be taking care of our kids.
Yes. So thanks so much, Dr. Vera, for having given us so much important information. And I just I'm going to speak in Portuguese just to let my audience know we're looking for a publisher for your book. Esse é o livro da doutora Vera, gente. A gente está procurando, doutora Vera, né? Está procurando uma editora que queira traduzir o livro dela e publicar no Brasil. I'm pretty sure you will find someone, Dr. Vera, because your book is it's amazing for all of us. So thanks so much for your time. Pleasure having you here.
Okay, thank you. Thank you for letting me speak.
No, thanks so much for coming. Bye. Are you stop the recorder?